أنا باسم الشافي أرقيك من كل سقام يؤذيك بيميني أمسح ما تشكو وبعمر الباقي أفديك وأتمتم دمعا ودعاء يرعاك الله ويشفيك وأتمتم دمعا ودعاء يرعاك الله ويشفيك لا بأس.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إن الحمد لله نحمده ونشكره ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا. من يهده الله فهو المهتد ومن يضلل فلا هادي له. نشهد أن لا إله إلا الله وحده لا شريك له ونشهد أن محمدا عبده ورسوله. إن أصدق الحديث كتاب الله وخير الهدي هدي محمد صلى الله عليه وسلم وشر الأمور محدثاتها وكل محدثة بدعة وكل بدعة ضلالة وكل ضلالة في النار. ثم أما بعد. Dear viewers at home, you are yet welcome to another episode of Earth Talk, where we discuss issues that has to do with our earth challenges. I am your regular anchor, Dr. Lukman Shitu Mohib, and today I have in the studio with me a seasoned lecturer, is a consultant general surgeon from Department of Surgeon. That's at Federal Medical Center, Bida, Niger State. I want our doctor to please introduce himself to our viewer. Doctor, you are welcome to our program.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. We are here today to discuss a very important health matter, and that is the topic that is not peculiar to even all of us here in Nigeria or West Africa. This disease is a global disease, and today we want to talk on cancer as a global disease. Dr. Abdurrahman, what exactly is cancer and why does it pose such important or significant health challenges to globally? Doctor.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم وبه نستعين. Well, to start with, cancer as it is defined as a new growth in the body that is abnormal, and it has some unique characteristics that make it to be called or referred to as cancer. And some of these characteristics is rapidly dividing, increasing in size, and also has property to destroy the surrounding tissue and even leave the area where it started and go to other parts of the body. And what brings about cancer is an abnormality in the growth mechanism, and this abnormality can be triggered by a whole lot of things. But what is peculiar to it is that even when that trigger factor has been removed or stopped, this abnormal growth behavior continues. So, and it's a very important health challenges that spread across the whole world.
Doctor, please, there's something I observed from this your explanation, given the fact that it's abnormal growth in the body. You mentioned that even after this abnormality has been removed, the development still continues. So what caused that? What's the reason for the further development within the tissue?
Yes, like it's a disease, because generally speaking, the way Allah subhanahu wa ta'ala has created human being is that when there is need for a replacement of some cells within the body,
okay,
so either by means of injury or by means of aging, or by other means by which when these cells are due to be replaced. So in an attempt to replace these cells, the cells divide and grow. But the normal mechanism that Allah subhanahu wa ta'ala has put in place will checkmate when these cells are supposed to stop and when they have done what they are expected to do. But when they become cancerous, this control mechanism is lost.
Okay.
And once that control mechanism is lost, so there will be no regulation any longer. So even if whatever triggers it has been removed, that abnormality continues.
Okay. Thank you, doctor. Please, I want us to now delve into the distribution across the world. Could you please explain how cancer rates vary globally? Is it peculiar to us in Nigeria or generally in West Africa, or what is the rate of the distribution?
Yes, cancer is a broad name and it entails all form of malignant growth in the body.
Okay.
So, and when we talk about the distribution in the world, it's cut across all nook and crannies of the world. There is no place in the world where we have human being, even among animals, that we don't have cancer as a disease. And the distribution is dependent on the location, the locality, the culture, and even the religious belief. So, and these factors will now determine what is the common type of cancer that is found in
a particular location
of the world.
Okay.
So, as it is, like we are saying, cancer itself is a global disease.
Okay.
Only that the frequency of what you have in a locality will be dependent on a number of factors.
Okay. I want, doctor, please, are there a specific region or population more affected by certain types of cancer, or it is just as you mentioned? Is it a particular, maybe you might not have to say here?
Yes. Well, like it is called a global disease. And once you say something is global, it does not exclude age, it does not exclude sex, and neither does it exclude other modality of interactions. So cancer itself, it cut across all age group, all tribes. But the only difference is that the type of cancer that you'll be having in particular age group may be different in the another age group. For example, there are some cancer that are particularly found in children. You can rarely find them in adults. And similarly, there are cancer that you can find in adults that you rarely find them in. So because of this, it cut across all race, all sex. In fact, there are some cancer that you can only find in man, not in woman. So, for example, if a woman doesn't have some structures in the body like prostate. So when you talk about prostate cancer, for example, now you can only find it in men. So and likewise, a man doesn't have a reproductive tract like cervix, ovary, uterus, fallopian tube, and all these can also come down with cancer.
Okay.
So it all dependent on which region of the world and which tribe or race or the culture and what they are subjected to in that area.
Okay, thank you so much, doctor. Let's go to some other parts of this question. I want us to delve into the risk factors. What are the primary risk factors that contribute to the development of cancer in the body?
Yes, cancer generally has a whole lot of risk factors, and when we talk about risk factors, it means these are factors that give or added to somebody's chance of having cancer.
Okay.
It's not that when you have this risk factor, it's a must for you to have a cancer. No, it's only telling that when we compare you, that you have this risk factor that we're going to mention some of them now, to a person that doesn't have this risk factor, your chances of coming down with the disease is higher. That's what they mean by risk factor.
Okay.
Now, generally, there are some factors that are exposed to cancer formation, but specific cancer also have their own specific risk factor. But now that we're talking about cancer as a global disease, so we are going to talk more on those general factors that predispose to cancer formation.
Okay.
Now, the first that is very common is, you can say, is a sporadic cause. That it occurs, you can't even trace any known cause, risk factor to it. This one we usually say we don't know the cause of this, because having ruled out every other factor that could predispose one to that cancer disease, you cannot find any cause, but the person is having it. So this is sporadic. They occur sporadically. You don't have any cause. Now the other one is commonly the age play a significant role. So there are some cancer that they occur in the aged. Once you are clocking a particular age and you are growing older, you are at risk of having cancer.
One form of cancer.
Yes, and there are some cancer that are usually found in the childhood. So all this is also. The other thing is sex. It's also a risk factor. There are some cancer that when you have that are peculiar to sex. So once you are either a female or male, you stand a risk factor of having that cancer that is specific to those sex. And another thing is what we refer to as hereditary. Hereditary is what you inherit from your own lineage.
So if your parents are cancerous in your
and it's usually inherited, there are some genes, they call them oncogenes. So that when there is a mutation or abnormality in those genes, they trigger abnormal growth that predisposed to cancer formation. So if these genes are transmitted down the generation, so one can come down like to have cancer. And likewise, the lifestyle. Oftentimes, people that are obese, they are morbidly obese, stand a higher chance of having cancerous diseases. And likewise, somebody that indulge in consuming alcohol a lot, so it's also a risk factor. And likewise, smoking is another form of risk factor. Then there are some areas that predispose to cancer. For example, in area where when you are exposed to what we call ionizing radiations, to radiations, in the area where there are fighting wars, nuclear war, or all sort of explosions. So if you are currently exposed to such things, you are likely to come down with cancer. And lastly, I would say also diet that you will consume sometimes stand a chance of being a risk factor for especially gastrointestinal cancers.
Okay, thank you so much, Doctor. I so appreciate the way you mentioned some of these things. Before we leave this area, you mentioned some of the risk factor that has to do with the age, sometimes diet, sometimes the lifestyles, and some those people that are obese, or sometimes even the kind of food we take. Please, can you please briefly enlighten our audience some of those things that we need to avoid as regard some of these things that can predispose us to those risk factors, so that before we leave that area, at least we'll give them some of those things that will be the take home before we leave the area of the risk factors.
Well, talking about risk factors, like I said, if we have to go by each of the factors that I have listed, then one can make an attempt to say you want to prevent against having a cancer disease. For example, before you can talk of age, so once you are clocking a particular age, that because some of these cancers they have their age distribution, and you stand a chance of having cancer, then for all cancers generally, you must be subjected to screening. So that when screening means a measure to detect the cancer when it is not symptomatic, when it doesn't give you any complaint. And at that stage, if by chance you pick a cancer, we regard to that phase as being an early phase. And when you treat cancer at this phase, you can achieve cure.
So it's better you go for screening. Which,
yes.
Of course, definitely we are going. I'm coming to that. The screening fact, the screening and the early detection is part of my question for you. But at least for that now, one of those things that would measure that our audience take home today is they should rather go for checking. For a test or screening.
Yes, that is that's the first thing.
Okay.
But concerning age, that is age and sex.
Okay.
So once you are clocking a particular age and you stand a chance of having cancer, then you consult with your physician and do proper screening so that you pick the cancer early before it becomes symptomatic.
What of the diet is just to mention, sir?
Yes, diet. There are some diets that predisposes to cancer, and there are some diets that are protective against cancer. So when we are talking about diet, oftentimes we relate diet with gastrointestinal cancers.
Okay.
What we mean by gastrointestinal cancer is that cancers arising along the tract of where we what we call alimentary canal.
Okay.
So that is what we regard to as that. Okay. So some of the food that predispose to cancer will be depending on where, for example, if one takes too much of highly salted meals or highly smoked meals.
Smoked food like smoked fish.
Yes, they are a risk factor for gastrointestinal cancer.
Okay.
And if one consumes too much of unsaturated fatty meals.
Unsaturated fatty meals, like what?
Animal fats.
Okay.
If you consume too much of animal fats, even red meat, as you are aging, the rate of consumption of red meat should be reduced.
Red meat.
Yes, and a diet that are preventive, we should, like in Africa, we take more of high fiber diet.
Okay.
So meals that we take, like our usual carbohydrate rich diet that we take, that we make us visit the toilet often, that we rarely get constipated, because prolonged constipation is also stand a risk factor of having gastrointestinal cancer.
So much.
Then even fruits and vegetables
will definitely prevent cancer.
So they are protective diet for gastrointestinal cancers.
Okay, thank you so much, doctor. Now let me go to my next question. I want us to go to screening and early detection that you mentioned briefly when we are talking about the risk factors. How important is early detection in the treatment of cancer? Let's assume you are having, one is already having one form of cancer or the other. How important is the early detection?
Yes, it's important to do screening in cases of suspected cancer, because like I said earlier on, screening, in fact, that's the current thing now for the treatment of cancer, that when you screen, you are aiming at preventing cancer, because you detect the cancer when they are not causing any serious problem. And by what we have said, if this is done, there are criteria for carrying out screening.
Okay.
So one of the things is that you must have history concerning that particular cancer that you are talking about, the locality, and how common is that cancer.
Where it's affected. That's what you mean by locality.
No, I mean in the region.
Okay, the region,
the community.
Okay.
So you must be well aware of that community, how they live, their nature, their culture, their tradition and everything, and the type of cancer that is common in that community. It must be a common disease that you know that people have been dying from this disease.
Okay.
And you must have an idea of how it is distributed. What is the common age at which people come down with this disease?
Okay.
So when you don't have an idea and you know people that are at risk, usually when they are clocking that age, you arrange them for coming down for screening.
For screening on time, at the early stage.
Screening can be done either by using some fluids within the body, or even taking some tissues, and sometimes may require using some instrument to look into the body. Okay. So one may need, for example, in cases of some cancer, once you take their blood sample, there are some markers that you can read within the blood sample that will give you an idea of whether the person stand a chance of having cancer or not.
Okay.
And there are instances, for example, in a gastrointestinal tract, because I have to be saying that because it's common in this part of the world. So there are facilities that we use to screen patients for early gastrointestinal cancers. We call them endoscopic procedures.
Doctor, I actually have that question with me because I want to ask what are some of those common screening methods that are available in West Africa and particularly in Nigeria. So now you are going there, at least you need to expatiate more on that.
Yes, so screening, there are a whole lot of screening. But screening there are some screening that are specific to each cancer.
Okay.
And like what we are actually talking about is cancer itself, the whole of cancer. Okay. So if we are going to be talking about the screening modalities, then we have to be taking it one after the other. Okay. But as it is, I can give an example,
okay,
so that we can have an understanding.
Okay.
So for example, when we want to screen for, let me give example of two cancerous diseases. Okay. Maybe breast cancer for a male,
female,
and for a female.
Okay.
Because male also has breast cancer, but only that is not common in them.
Okay.
So breast cancer for a female, and when we talk about prostate cancer for male.
Okay.
Now, if one is going to screen for prostate cancer in a male, so the early thing that one does is that once you are getting to the age that you are likely to have prostate cancer, that is 60 years and above, and you don't have any symptoms, so you present to the physician. The physician will evaluate you by taking some history from you, examine you, and part of the screening test that you now do now to have an idea whether you are likely to have prostate cancer or not is the person will examine your prostate by putting hand into your anus and examine the prostate. There are some features that will be picked that will be suspicious of cancer or not. Then after that, one of the screening tests you do again is what we refer to as doing a serum PSA assay. This prostate specific antigen hormone is secreted and is synthesized and produced by this prostate gland. So it gets a value that if it is as high, is getting to a particular value, it should be suspicious of someone likely to have prostate cancer. Okay. And lastly is that one can only do what we call a transrectal ultrasound, as well as transrectal ultrasound prostatic biopsy.
Okay.
So when you do all this, and even at this stage the person is not having any symptoms, and you put all this together and you can pick a symptom of malignancy, then you say you are the person that it has been picked when the person is not symptomatic.
Thank you so much, Doctor. I want, before we round off for this episode, I want us to go to this particular area of the cancerous treatment, and that is what we call the diagnosis and the staging, as you call it in your field. How is cancer diagnosed, and what are the keys that are related to this? When we talk about the diagnosis and the staging, sometimes we say
diagnosis simply means measures you take to arrive at a particular assessment and initiate treatment.
Okay, so it's different from screening.
It's different from screening.
Okay.
Screening is just toward detecting a disease when it is not symptomatic.
Okay.
But diagnosis, disease is already symptomatic.
Okay.
How do you now come down to know which type of disease it is?
Okay.
So in medical practice, diagnosis follows a particular outline. Okay. So if you are going to diagnose, there's what we call history. That is the complaint from the patient that is having the symptoms. Okay. So one must listen to the patient. What are your complaints? The complaints will be dependent on the type of cancer that we are talking about.
Okay.
And the next thing is what we call clinical examination.
Okay.
The physician will examine the patient. And these are what we refer to as, the first one is what is regarded as the symptoms.
Okay.
The complaint of the patient are referred to as symptoms.
Okay.
Whereas the findings of the physician are referred to as signs.
Okay.
So that you because of your own expertise and what you know,
Okay.
you know what to examine for, and you know what to pick when you are examining such a patient.
Okay.
And lastly is to carry out investigation.
Okay.
So investigation usually for cancers, they are usually geared toward confirming the diagnosis. You have the symptoms, you have the signs. Now you want to use your investigation that this thing that I am seeing, let me confirm that is what I am thinking or that is actually causing it.
Okay.
So that's the first. Then the investigation is also geared toward staging the cancer because it's already symptomatic.
Okay.
So you want to know what stage is this cancer?
Okay.
Is it early stage? Is it an advanced stage?
Okay.
Then the other phases of the investigation are investigations to now assess and evaluate that patient
Okay.
for fitness of treatment or intervention as the case may be.
Okay. When we say cancer staging, staging in cancer, what does it entail in terms of why is it crucial for treatment planning? When you say, okay, you mentioned about staging now, why is it so important to know the stage?
Yes, like cancer is a new growth in the body.
Okay.
That is not part of this body.
Okay.
And it has a focus where the abnormal growth starts.
Okay.
And that abnormal growth, if you don't intervene on time, as where it is going. Okay. And the ultimate place where the growth is going is to kill the patient. Now, when we now say staging becomes relevant because we realize that there are various stages that come down with different presentation.
Okay.
And if you can intervene or at any of this stage, the outcomes are usually different. So staging becomes relevant in cancer to prognosticate, that is, to determine the outcome of intervention.
Okay.
And also to class cancer into early or late.
Okay.
So now, when we now talk about it, generally cancers can have different stages. Okay. But they can range from stage 0, stage 4 in some instances. Sometimes they can range from there to stage 5. Even in some instances, it can range to stage 6, depending on the type of cancer. But staging becomes relevant for managing cancer because each stage has their own treatment approach. So once you have the stage, you know what to do
at a particular stage, at a particular time.
You don't just give all cancer the same treatment. For early cancer, and you know your expectation.
Okay.
And when you know that you are treating early cancer, you want to be aggressive because you are still the likelihood of you still achieving cure is
very high.
So you want to be aggressive, encourage the patient and do that. Okay. And when you now have a late presentation based on the stage,
okay, now
even whatever you are going to do, you define your aim. Either, of course, you won't be looking for cure, but whatever you are doing is just to make sure that patient doesn't suffer much, and you improve the quality of life in such a patient, and you will not waste resources. You will not be too aggressive because you know that the outcome is not likely to be better. So you will not waste unnecessary resources on that. Unlike when you have early stages that you know that this patient, if we intervene on time, they can still have a cure. So the essence of staging is that it helps to prognosticate, it helps to determine what form of treatment to give to patient, and also to evaluate a disease state.
Thank you so much, Doctor. I really appreciate giving us a lot of information about the cancer and some of those things. Before we go for today, at least I want us to call it a day from now because we are actually running out of time. I want you to please, what advice do you have for our listeners at home, especially with regards to screening and the early detection and possibly going for tests before this thing become a serious problem?
Yes, my advice to everyone at home is that I think we should be familiar with our history, particularly family history.
Okay.
And we should also be familiar with the history of what happens in our locality.
Okay.
So that when we know the people around us or the community we are aware of what is the commonest type of cancer disease they have there, then I think we should expose ourselves to knowing about those diseases, so that when we are clocking the age that we are likely to have it, we present ourselves at relevant hospital for screening, so that it can be detected early. And once, if we have family history, even if it's not happening in that locality, but in our family, we can see up to 1, 2, 3, or 4 generations having the disease, then we can also seek more knowledge about it and also present ourselves early for screening, so that they can detect it and take care of it. And finally, is that I want us to know that there is no cancer that is not curable once they are picked early.
Okay, thank you so much, doctor. I want us, before we go for today, I want all our viewers to please have this as a take home, that there is no cancer that is not curable once it is picked very early. That is one. Another thing is that, this kind of, we are going to talk more on that, but I want our listeners to observe this. Recently, we observed this type of cancer, especially the breast cancer among the females, so rapid. And this our culture of not wanting people to know and trying to hide a disease that is very dangerous. This is not too good for us. It's really, we have to pick from today's episode that we need to go for early screening, and early detection will save the day. We thank everyone at home, and we want you to please subscribe to our channel, because by you subscribing to our channel, we make our program to have wider viewer, and that will allow us to continue to produce every day. And especially, I want you to, you can also have your place your adverts, and you can see our information on the screen. So this will help us to continue, and we have our TikTok, our Facebook, and especially the YouTube. So please, even those numbers on the screen are there for you to contact if you have any information, or if you want any information for us. We thank everybody, and we say Assalamu alaikum wa rahmatullahi wa barakatuh.